This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Hi, I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary allergist and dermatologist, and...
Hi, I'm Janet Novotny-King. I'm Alice's sister, and I am not a board-certified allergist and dermatologist. I am a pet lover, rescuer, and owner, and we're here to help you become really smart with some science-based information about taking care of your loved pets.
You know, Janet, you may not realize this, but if you have a problem with your pet's eyes, that is an emergency. And when I was in general practice, we always made it a priority. If someone called in about their cat's or dog's eye, something was going on with that, we got them in that same day, because you can lose an eye within 24 hours.
Wow.
They can go south fast. So I thought today we would ask a veterinary ophthalmologist, Dr. Jeff Bowersox, who is a Buckeye.
O-H.
I-O.
Jeff, you gotta do it on the pickup here, okay?
All right.
O-H.
I-O.
Oh, wait.
Okay, he's learning.
Anyway.
He's learning. We'll get him there.
Anyway, Jeff got his degree in molecular genetics and his veterinary degree from Ohio State. Yay. He then completed an internship in your neck of the woods, Janet, in Connecticut, went on and did a residency in ophthalmology, and now is at the Veterinary Specialty Center of Delaware, where he was graciously awarded, I love this, Veterinarian of the Year in 2006. I mean, I think that is like cool beans. But anyway, we want to welcome Dr. Jeff. And Jeff, I have to say one thing. I hope the Bidens don't call you to check Commander out, because Commander's already bit a couple of Secret Service people.
Yes. Yeah, we've had lots of Biden run-ins here. My kids go to school very near where his house is, so they have delays getting the school bus sometimes because the roads are shut.
Oh my God. Hey, the other thing before we riddle you with questions, last week when we wanted you to do the show and you couldn't, you were going to the zoo. What were you seeing at the zoo?
There's it's called a toka toucan. It's actually the oldest one in captivity. They're trying to mate him to a female, and she beat up his face. So I was taking care of him.
Oh.
You mean like pet?
Well, they have long beaks, toucans, and they kind of sword duel as part of their mating ritual, and she then grabbed the top of his head. So, yeah.
Wow.
That's sexy.
Yeah.
Were his eyes okay, though?
I mean, there's no okay, but it's getting better.
Oh, wow.
Have you had much experience with the eyes of toucans?
No. But
okay.
Several different zoo animals of all different types, but including lots of weird little quirky things. But yeah, no, it's the first toucan I've dealt with.
You know, Janet, that's what's cool about optho, because I almost went into optho, Jeff, but I don't like surgery. So, because I learned so much from Dr. Partial, but it's so cool because you see so many different species. I remember one time I ran home for lunch and came back and I heard this primal growl, and here it was a young tiger that someone had brought in, and Dr. Partial was, doing his eye thing on it. So it was, really cool.
Yeah,
I've
operated on a couple lions at the Phoenix Zoo, some geckos, lots of different things. One of my experiences with Dr. Partial was, this was before I was a vet or anything of that nature, and I was just along to ride, and he said, "You come with me. We're going to the Cleveland Zoo. We're going to go look at a baby giraffe." And my job was to run behind him with the step ladder to throw down to the ground so he could run up and look at the baby giraffe. But it was
Mm.
quite a visual, because they had these giant boards that they put cushions on, and all these zookeepers were running around trying to trap the giraffe against the wall. So I ran out once they did that, stuck the step ladder down, and he ran up and looked in the eye. So
He was something else. Janet, you met Dr. Partial, didn't you?
Yes, because you had me come to the practice and you said, go look in the refrigerator. And like an idiot, I opened the door
Oh,
and it's like all the eyeballs in jars. Like,
okay.
she goes, there's a
All right.
cow's eye
Probably
and
going to be sent for biopsy. Okay, got it. Yeah.
got it. And I was like, great.
Yeah. And
Not my
but I
thing.
also looked at
yeah.
an owl at the zoo last week too. So I was that owl unfortunately also had a trauma to his eye. Owls get a lot of traumas because their eyes are pretty big.
They do. That's so sad. These poor raptors. Is it because they fly low into windshields of trucks or what?
They are,
And windows like
yeah.
Flaco.
So they do sit by the roads, and then when the cars go by, rodents and whatever
Mhm.
get sort of stirred up, and then they try to chase them, and they'll get swooped in on. Yes. In
Yeah.
the car.
But
Yeah.
Flaco, the famous New York City Central Park Zoo owl, died because he went into a building on the Upper West Side. And he
Mm.
was alive when they found him, but he died. He had freedom though for a whole year.
Oh,
He just passed away. I think that was like a couple weeks ago. They had a big like memorial for him.
oh,
So
wow.
yeah, I kind of followed him for a while. So okay, here's a question: do animals see color?
Animals see color. Dogs do see colors, but we see in trichromatic colors. So we see red, blue, and green. Dogs don't see reds as much, and their eyes
Mm.
are all set up a little different to see better in dim light, and not see in bright light as much. Um, they don't have as many cones. You hear about the retina, if you
Mhm.
remember from high school biology. There's different layers of the retina. There's 10 different layers, and then the outer layers are made up of the photoreceptors. The photoreceptors have rods and cones, and we have lots of cones because we read and we can see lots of colors, and we do fine-tuned vision. Dogs don't have as
Mhm.
many cones; they have a lot more rods, and a lot of nocturnal animals will have more rods. The animals that have the reflection in the back of their eye, that's called the tapetum.
Mhm.
So when you're driving down the road and you see the raccoon looking at you, and the green glow is there, they're set to see in dim light, but they don't see colors as well. But they still see colors.
So does the
When
bull?
should
Jan, I want to ask this.
go ahead.
So does the bull see red? When they do
I
this?
was
No, seriously.
The most
I was going to ask that, but I thought it was like too
realistically the
dumb.
motion more than it's realistically
Motion.
motion more than
Okay.
color. Yeah. And
It's
interestingly, they did
Toro.
one of the vision researchers that's one of my mentors as well from Wisconsin. He was charged with working with one of the camouflage companies, and it turns out that the camouflage that they were using for deer when they did photoreceptor studies on the deer made people stand out as bright yellow objects in the woods instead of camouflaging in. So they had to.
Good for those
Yes,
hunters.
they fixed that, I guess. So I think the deer are still in danger, but it was an interesting.
Oh my God. Hey, Janet, you don't know about this, but Jeff, do you remember when Dr. Partial would see someone pulling into the parking lot with the dog's head out of the
Oh yeah.
window? He would ream them a new
Oh,
one because, oh my God. And I'm sure Jeff will tell you, Janet, because he was pulling like twigs out of the corneas of eyes because at 30 or 50 miles an hour and that the eyes are out like that.
Yeah.
It's horrible.
And they're not really blinking. They can't really
No.
blink, right?
I used to ride a motorcycle, and when you put your shield down, all sorts of stuff would hit you in the shield, and that would just hit the
Oh.
eyes. I remember that distinctly, but I also where I did my residency was in Arizona, and it was dry, and we had this dog that had dry eye, and the owner was very mad at us because we could never get it fixed. And my mentor was out in the parking lot and realized the dog was riding around with the top down on a convertible, and he gave him the riot act too. He's like,
Good.
So,
Good.
there's
Good.
common sense stuff
Good.
sometimes.
So that's a big no-no to let your dog's head hang out the
Yeah,
window.
my family makes fun
Or
of
the
me
top.
because I only crack the window so much so their nose can go out. But yeah, you really shouldn't have.
That's what I do. Huh.
to.
So as a pet owner, what are like alerts or concerns if something's going on with my dog or cat? What that I should take him to the ophthalmologist or the vet?
Well, I mean, obviously, the first, it can be a wide range of things. So, obviously, if your dog's bumping into things and vision doesn't seem
Mm,
there, that's sort of an extreme. But sudden things, the
mhm,
subtle things that you can see in the beginning would be just all of a sudden excessive tearing, or squinting, which we call blepharospasm, where the eye's twitching. If the eye looks
mhm,
red, if the third eyelid is up,
Hmm.
dogs have third eyelids and cats have
mm.
third eyelids. We have just a little residual skin there. We don't have the full third eyelid. And obviously, if they're pawing at it or digging at it. Um, so
Huh. Okay. Good
those are
to
sort of
know.
hall.
You know what?
So dry.
You know
Go
what
ahead.
I always thought was kind of an oxymoron was why, when you have dry eye, does it seem like you have more tears?
Yeah.
Can you explain? You know what I'm saying? You have more discharge, I guess I should say.
So there's a couple reasons. One is dry eye. Many times it'll start out sort of the symptoms will kind of wax and wane, and so what'll happen is as your eyes get drier, they kind of get itchy, and then you reflexively
Hmm.
tear. So if you've like been at the beach and something gets in your eye, you get a lot of excessive tearing. So dogs will be kind of itchy and irritated at first, and then they'll all of a sudden look better for a couple days. And then once the irritation gets better because they're starting to reflexively tear, they'll start to get dry again, and this is wax and wane symptoms. But the tear film is made up of sort of three layers. And the middle layer is the watery parts of our tears. And then we also have a layer of mucus on the inside that helps the tears stick to our corneas. So when we're walking down the
Hmm.
road, our tears just don't fall off and sit at the bottom of our eye. And then we also have a layer on the outside that's made up of fats or lipids, which comes from the glands along our eyelid margin. And those lipids help prevent the tears from evaporating. So watery, when we have a problem with dry eye or keratoconjunctivitis sicca is the medical term, when we have a problem with that, the middle layer is missing. So the mucus and the lipid
Hmm.
layer is left behind, and it turns into this very viscous, gummy stuff that gets up
Hmm.
under the eyelids, and it's very hard to get to clear out, and it's very copious.
Huh. So some dogs have those kind of like protruding or
Yeah,
bulgy eyes.
Hmm.
Do they have more issues than like a dog that doesn't
absolutely.
or a pet that doesn't?
When I first moved to Delaware, the my two partners were both surgeons, and they started realizing that instead of having big dogs that were limping walking around their waiting room, they had all these little buggy-eyed dogs sitting there, and they wondered what was going on. And it's an issue with exposure. Obviously, those a
Yeah.
lot of times the orbit is very shallow in those dogs. So our orbit is kind of where our eyeball sits or where our globe sits. Kind of like if you took a tennis ball in half, cut it in half, and stick our
Mhm.
eyeball in there. There's bone all around it.
Hmm.
But a lot of these brachiocephalic dogs, or the dogs with the bigger eyes or prominent eyes, they don't have a lot of bony orbit, and their eye is sitting out in front of their skull, and it's just covered by their eyelids. So it's more exposed to just blunt trauma through the eyelids. If
Hmm.
something hits them,
Hmm.
or if they're running through the doorway the wrong way and hit the side of the doorway,
Hmm.
um, or if they get tugged on their neck, their skin gets pulled, that can
Hmm.
enter their eyes. But a lot of those dogs also, they just don't blink completely all the time. Every fifth or sixth time, their eyelids will come together and touch, but they don't touch all the time.
Hmm.
And then they'll sleep with their
Huh.
eyelids open too, a lot of times, and that leads to those middle parts of their corneas getting dried out, and then they get problems with injury and infection.
With the dogs with the bulgy eyes, we were always told in general practice that, like, if you were trimming their nails, because what pug likes their nails trimmed? None of them. But you can't like put a lot of pressure on their neck because you can pop their eyeballs out. Is that true, Jeff?
For the medical term for when the eye comes forward in front of the lids is called a proptosis. And
Mhm.
if there's any sort of tugging on their neck or pressure on their neck, it doesn't take much for that skin to get from the front of the eyeball across the equator to the back of the eyeball, and then it gets trapped. And a lot of traumas, that will happen with a lot of traumas. Sometimes, like another dog, they have these things called big dog, little dog incidents where another dog grabs a
Mm.
dog by the neck and starts shaking them.
Yeah.
That can cause
Mm.
problems with that. But yes, you don't want to.
It's like those things you squeeze and the eyeballs pop out.
Similar.
Oh,
Yes,
The toy.
those are good veterinary
well,
What is
terminology.
what is cherry eye? what is cherry eye? Now that we're talking about popping eyeballs.
So the upper lid and the lower lid are the lids that have hair on them, but the third eyelid is towards the nose, and the third eyelid at the base of it has a gland, and that gland is called the gland of the third eyelid. And when that gland sits there and it's held down by a piece of cartilage, it's like a tongue in your shoe. It just sits at the bottom and it's tied down in the ventral or the bottom part of the orbit. If that gland swells or those ligaments are abnormal, it'll squeeze up and squirt up. So cherry eye is sort of the layman's term for the prolapse of the third eyelid gland.
Is that dangerous?
It usually is. Well, most of the time when we're treating it, we're seeing it as a congenital problem or a problem that we see in young dogs. Usually doesn't hurt, but when it sticks up, the dogs will rub at it. It'll bleed sometimes. Most of the time, it's new puppy owners that have them, and they freak out because they've never seen something like that before. Most of the time, though, it doesn't cause pain directly, but if they rub their eye or if they get some dogs will rigorously rub their eye in like dirt or on something. If they get something stuck in there, it can turn into a problem with the cornea. Yes.
Well, sometimes our golden will come in from outside and it drives me nuts. She'll go up against the couch, like her eyes, each side. Is it itching? Or is she just doing that to be annoying?
It can be, so sometimes when they're rubbing their face, it can be their teeth. It can be something with their folds around their eyelids. It can be something with their ears. My dog does that in the morning when she gets up. She rubs against the wall. So every couple of weeks we have to clean the brown stain down that's there. And but yeah, it can be from lots of different things. After eating, a lot of times dogs will go and rub on the furniture just like a nap. So,
Oh, good to know.
Now, what about, I always used to have clients tell me, like I'd see the haze of the cornea that sometimes can happen as they get older, but people always think it's cataracts.
Yeah.
We mention cataracts because also I think that the regular pet owning public thinks that, it's real easy to take cataracts out of dogs and cats' eyes. And from what I heard, at least what Dr. Partial told me, that cataract surgery in the dog is much more inflammatory than in humans. And is that true?
Absolutely, yeah. And even to this day, and there's newer drugs that are out that are trying to help with that and newer ways to treat inflammation. But every species is a little bit different. So cats don't have as much inflammation as dogs do. But as you get towards humans more, so I have done some surgery on some monkeys. As you get towards humans more, though, the inflammation is less. But the immune response is very, very persistent. So for you and I, sometimes we don't have to have any drops, or we only have drops for just a couple weeks after surgery. But most of the time in dogs with cataract surgery, they need drops for quite some time, if not forever, to protect their eyes from inflammation from the lens.
Do I need to protect my dog's eyes from the sun?
In most situations, unless they're in an environment where there is absolutely no shade and they're living in the desert somewhere, most of the time dogs are pretty smart about getting into the shade if their eyes are bothered from it.
Interesting.
Also, Janet, there's something I want Jeff to talk about too that's very serious. And I remember doing the externship at the ophthalmologist, and they'd have to put drops in like every 2 hours. It was a melting ulcer.
Yeah, that happens a lot in those bigger-eyed breed dogs, the dogs that have the more prominent eyes, but it can happen in anything. The cornea is also made up of multiple layers. The cornea is the clear window in the front part of the eye. It's sort of the interface between the outside world and the inside of the eye. It can be damaged for lots of different reasons, whether it's a tear film problem, whether it's a trauma, whether it's an immune-mediated genetic condition. But what can happen is if the epithelium, which is the outer layer, is broken down, that exposes the middle layer, and the middle layer then is prone to getting infected from bacteria that's just opportunistic from around the skin and around the eyelids. And there's a certain type, or some types of bacteria produce a byproduct called collagenase. That collagenase starts to melt into the cornea and starts to turn the cornea more liquid. And it's the best analogy I've heard is it's kind of like if you have a giant block of ice and you took a tiny little red hot cinder and set it on that block of ice, it'll start to melt down into the cornea or into that ice. And that, so that happens in humans as well. But when that happens with us, many times we'll be like hospitalized and the nurse will be putting medicines in very frequently for us.
The other thing that I remember too was that how the ophthalmologist can tell systemic disease like toxoplasmosis and other diseases by looking at your eye and the retina and the vessels. Talk about that. I think that's fascinating. It's like the windows to the soul. You got this bad disease, and I just had to look into your eyes to see it.
Yeah, I mean, it's the window to the body, and the eye is an extension of the nervous system, and the retina is an extension of the brain. The eye, it behaves many times like a lymph node. So when you think about it, if your when you get sick, your lymph nodes sometimes swell up. The inflammation can bridge into the eye and cause the eye to get inflammation. So there are certain things that you can see, like retinal conditions, that some of the lesions are indicative of certain medical conditions. So you start testing for that. Also in dogs, which is different than humans, animals that have high blood pressure, like older cats, they can get some of their retinal vessels will hemorrhage. So we can tell by looking in there that just by the shape of what the vessels look like, that there's a potential that the animal has high blood pressure. So then we test them for high blood pressure. And the big metabolic thing we deal with in dogs is diabetes. Dogs with diabetes and cataracts. It's almost, the rule of thumb is that about 85 to 87% of dogs will get cataracts within 2 years of their diagnosis. On average. Yeah. So it's unfortunately a thing that happens. We have more problems as humans. We have more problems with retinal bleeding from diabetes and retinal hemorrhages. Not as much with cataracts, but dogs get cataracts and not the retinal part as much.
I think it was in the news last week that you're supposed to look into your dog's eyes, like total eye contact, for like a few minutes a day for emotional support. It's supposed to do something emotionally for the dog. Honest to God. So every day I'm like, Libby, it's our time. We just kind of look at each other.
Okay.
Honest to God, it was. I just heard it on the radio this week, and I'm like, okay, I can do that.
Well, there's a lot of, just like petting a dog causes physiologic changes. Having the big soulful eyes causes physiologic changes. That's what attracts a lot of puppies and certain big-eyed breed dogs to owners, is because the way they look at you. It's very calming.
Yeah.
I don't know.
What
I will warn those dogs don't like to be stared at a lot of times.
Right.
She doesn't mind at all. She loves the attention.
Jeff, what about plastic surgery, like in Shar-Pei and
what?
Yes. Oh, yes.
Yep.
Yeah.
They get lifts.
Well, they have a lot of issues where their lids they have extra skin, and their lids will curl in
like this.
And when the lids curl in, they cause the skin will roll in and touch the cornea, and that'll cause problems, and that's called entropion. And you'll also have situations where you have very baggy-eyed breed dogs, like some Mastiff breeds, where their skin is very saggy, and their eyelids are not along the edge of their eye, and they're drooping down, and you have to tighten those up a lot of times too, because they collect dust and debris and everything from the environment.
When women have eye lifts, they'll sometimes change the color of their hair or their hairstyle. So you look at them and say, you got a new hairdo, but really they had a lift. So I wonder what the dogs do.
Well, they go from being not able to see and painful to being able to see and open their eyes. So I don't think they care what they look like. They just care that they can run out.
They're ready for the red carpet.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. contact your veterinarian about these prescription Blue Buffalo diets. I'm concerned in these diabetic dogs, because it's usually old dogs, that like a diabetic poodle, okay, and they have cataracts. Do they turn around 100% after that surgery because they hadn't been seeing for so long? What's the prognosis there?
So the older techniques involved bigger incisions in the globe and wider. Basically, we didn't have some of the equipment that we have nowadays to do things with smaller incision and less invasively. So in the old days, or in the past, what we would do is wait until the dogs became very impaired, because we knew the risks of some of the complications were pretty high. Nowadays, the
Yeah.
risks are going down, and we intervene earlier. So we try not to have them be completely blind. Many times we will try to time surgery so both eyes are being done at the same time, just because of cost. One anesthetic, one setup time, one surgeon time, versus doing things different. Because the biggest cost in cataract surgery, yes, there's a lot of expensive equipment. It's the same equipment that you and I have used on us, but the biggest cost is
Yeah.
anesthesia and the follow-up care. There's a lot more follow-up visits, but the big thing is anesthesia. So um, if everything goes well, as it does 90% of the time, if there's not pre-existing kind of problems, dogs will regain their sight. They can get artificial lens implants, and they can go on and live the rest of their lives with vision. But it is something that needs to be maintained and watched. So it's just like being a dog owner that has a diabetic. That's certainly a big commitment to your pet. Cataract surgery is a big commitment to your pet too. It's a long term.
How would you know if your dog had glaucoma? Because people with glaucoma,
Yeah.
although people don't know they have glaucoma when you think about it,
Yeah. The big thing, there are some so glaucoma is categorized into a couple big categories, and one is primary glaucoma versus secondary glaucoma. You can get glaucoma from any sort of thing that damages the eye. So a trauma, a tumor growing inside the eye, and a really bad infection or something, and those are secondary causes of glaucoma. But the thing we deal with a lot is primary glaucoma. And in humans, primary glaucoma is what's called open angle glaucoma. So it's a little bit slower to progress because it's an open drainage angle inside the eye. And we age slower than dogs. So, we can have glaucoma for 20, 25 years before it becomes significantly vision impairing if caught early. Dogs have something called closed angle glaucoma, where they're born with some malformations of how their drainage angle works. And so unfortunately, sometimes their vision will suddenly change and suddenly become uncomfortable. So many times, or the majority of the times when we're diagnosing glaucoma, it's because the dog presents with a blue eye or a painful eye or an eye that they won't let the owners touch. In some situations, that eye is already permanently blind. In many of those situations, it's already permanently blind. And we work on trying to get that eye comfortable, but we also then recognize that the other eye is predisposed to it and start treating on that side to try to prevent problems. And again, there's some newer techniques with that, with lasers and intraocular things that you can do to help stop vision loss. But any of those things are invasive too. So there's always a fine line of intervening and what kind of pros and cons with intervening and when you intervene. So it takes fortunately and unfortunately, it takes a good relationship with your veterinary ophthalmologist to try to determine what's best for your pet.
Are there more breeds that are prone to glaucoma? Like, isn't Basset Hound one of them?
Basset Hounds are a huge breed to have closed angle glaucoma. A lot of terrier breeds will get glaucoma because they have lens luxation associated with that. So terriers have a condition where their lens can break loose inside their eye and start to shift around, and that can cause problems. So a lot of it is breed oriented, and your vet should, your general vet does or should know what breeds are more predisposed to different things. They can talk about screening your pet at general visits.
So what's your favorite ophthalmology story other than the chasing the giraffe with the ladder?
That might have been it.
That I
That
mean
was
that was a good one.
my first. Well, I actually met the thing that entered. I was riding around before I got into vet school. I was riding around in working as a radiology assistant, basically trying to get into vet school, and I was riding with a gentleman named Dr. Forthover down in Lorain County, and he would go out to
Mhm.
people's houses, and they'd have a horse that was lame, and so he'd
Yeah.
I'd have to hold the X-ray machine and carry it back and forth to the truck.
Oh my
But one day he said,
Yeah.
"We got to go look at this horse. It's at Dr. Parshall's office." And when I went over there, I was amazed because horses are very strong. Obviously, they're very big, and they don't like getting eye drops when their eye is painful. And so they get there's this apparatus called a subpalpebral lavage system where we can put a little tube up underneath their eyelid and then have that tube run down their neck, and then it gets braided into their mane, and you can just squirt medicines in from while you're standing back away from the horse without having to touch it, get kicked, bit, all that stuff that horses like to do when they're sore. That whole apparatus just fascinated me. So that was my start to being interested with that. And then certainly things like, yes, running around the
wow.
ladder also helped. But yeah, there's a lot of neat things. I'm trying to think. I've done, we did, I got called to the zoo one time for a tree frog, and the tree frog had a piece of straw that was stuck through its eye, and it had a cataract. And they said, help
Oh.
this. And I basically opened the eye up a little, and the straw and the cataract, the lens looked like a lollipop on the end of the straw. I kind of plucked it all out, sewed it back up.
Huh.
And frogs are lower in the phylogenetic spectrum there, and they can regenerate things, and the cornea healed, and the frog could see, and everybody was happy. But the interesting thing about that is how the zoo vets had to anesthetize the frog. You can't really put a tube down their throat. So what they ended up doing is mixing some anesthetic into a jelly, and they just would lay the frog on his back and put it on his belly, and it would absorb into his body, and he'd start to get groggy and fall asleep. And if he was getting too asleep, they'd take a tongue depressor and scrape some of it off, and that's how they managed the anesthetic level on him overall. So.
Oh my God. Have you ever been like, I remember one time during the externship, a policeman brought in his own pet Rottweiler, and Dr. Parshall couldn't get near it. I mean, muzzle, no muzzle sedation. And of course, Dr. Parshall gave him a good talking to, you know. But have you ever been fearful with a wild animal or even a domesticated animal to examine their eyes?
Commander Biden. He was
Well, I
running.
know.
Yeah.
He's not going to answer the phone if he sees it's Biden there.
So there's kind of an interest. This may be long, but it's a kind. I've been scared a couple times. A couple of the times by the police dogs, but not because the police dogs are very hyped up. We
Yeah.
do have the ACVO puts on a service dog exam event every May, and we enjoy helping animals that are service dogs or working dogs. But sometimes, yes, the police dogs come in and they're very, very aggressive. And one time we had this dog that was pretty wild up. The handler was there. He didn't have the greatest control of the dog. The dog actually leapt up and hit him in the chin. The dog had a muzzle on, hit him in the chin, and broke his lip open. And I said to him, how do you deal with this every day? And he goes, well, this dog was actually acquired by the FBI, and the FBI wanted to use him, but he was too crazy. And so the state police got him. And I said, but still, are you scared of him? What's happened? He goes, what happened a couple weeks ago, I was in a wrestling with a criminal, and he took my gun, and the dog took the gun from him. He says, so I can never be mad at this dog because he saved my life. So, you just deal with what you deal with.
Wow.
So that was one scary story.
That guy.
The other scary story I had was actually working on one of the male lions at the zoo. He had an injury, and we did the surgery on his eye. And when you go every veterinarian kind of maybe thinks that they want to be a zoo vet, but the zoo vet is actually the least favorite person in the zoo. I've been to the zoo with riding through the zoo on a golf cart, and animals are throwing stuff at the veterinarian because whenever the vet shows up, there's usually a shot involved or some sort of painful issue that needs to be done that they don't like. The animals love their zookeepers though, usually because the zookeepers are the ones that feed them and bring them in and out. But, so I have to go visit this lion after surgery, and they're driving me up to the lion house, and I hear this lion screaming, and I'm like, "What's going on?" They're like, "Well, he normally goes out at 6 in the morning, and we had to keep him in to see you, so he knows something's up, and he's not happy." And so I go into this room, and there's this hallway that's only about 3 feet, 4 feet wide, and on one side is a cement wall, cinder block wall, and the other side is a wire cage, just like a wire fence, just normal wire fencing. And this lion is pacing up and down the fence. And I said, "Well, how are we going to get him to look at? Because it's a 12-foot area." And he goes, "Well, I'm just going to put this piece of meat in there, and he's going to chew on it, and you can just squirt and look at his eye." So he does this, looking. So I'm literally across the chain link fence. Those dogs, and the lion is spitting at me, and it's breathing on me. I get a bit of an exam, but then he walked away and then ran full speed and jumped on the fence while I'm squatted down there waiting to look at him. So basically, I like to tell the story that I got to witness the last thing some small pygmy got before he got eaten in the wild, but I survived it. That was probably the most scary I've ever been with.
So which four-letter word did you utter?
It was beyond actually.
TLP.
Yeah, you couldn't really actually say anything. It happened so fast, and it's amazing how something.
Oh my gosh!
Wow. The few times as a dermatologist that I went to the zoo, we skin tested a clouded leopard, but it was kind of like, okay, he's ready for you, and you just waltz right in and shave the area, and I put my skin test in the sense that they were already sedated, and they didn't have to chase around or anything. But with you doing post-op exams, yeah, I don't think you can sedate them every time, right?
So we ask this of every guest. Jeff, what is your pet or human peeve?
Yeah, I mean, I was thinking about this because I was preempted on it, and I think the thing that every specialty has different things. So what we are constantly worried about is what you've already kind of alluded to, is self-trauma to the eye. So we can do this amazing corneal graft donor repair, and everything's reconstructed, and the dog can go home and rub itself against the furniture or scratch with its back leg and rip everything apart that you've just spent hours to do, and everybody's all upset about it.
Yeah.
So the thing that is my biggest pet peeve has to do with the surrounding of the e-collar, the Elizabethan collar, the plastic cone. I would venture to guarantee that when we have an appointment, probably at least half of that appointment is going over why the cone is needed, and having owners just be like trying to come up with all these different solutions that me working in ophthalmology for 35 years haven't come up with, other than you just need to put the cone on. But the newest thing is these blow-up collars that go around the neck that look like floaties.
Yeah.
And those are great to keep your dog from turning his head and chewing on his back leg. It does absolutely nothing for his face, because he can still walk up and rub against your pant leg, do whatever with that. People are like, "Look, I found this new collar, and you didn't need that cone." I'm like, "Well, it didn't do anything." So that's my biggest clinical pet peeve, I guess, is that situation.
Have you seen the ones that people fasten with pool noodles,
Yep,
like a necklace?
Done pool noodles.
Like on
They
their
do
own?
have ones that now look like they're called optivisors, that are a little thing that comes around the face, almost like a Darth Vader thing. And those work pretty well, but unfortunately, a lot of our breeds are like pugs. They snoot a lot, so they got a lot of stuff inside of that visor, and they kind of need windshield wipers on both sides.
This has been really informative. I mean, I learned a lot, Alice.
Good. I mean, that's what we aim to do. I mean, Jeff and I, as veterinarians, I mean, we got to teach you people.
I know, the stupid humans, right?
No, I didn't say that because anybody that loves and cares for their pet, they're
Yeah.
fabulous as far as I'm concerned. Jeff, I have to tell you, I'm in Sanibel right now, and one of my golden rescues was looking out the bedroom window at 7:30 in the morning. She never
Oh,
barks or growls, and she was doing this low growl, and there was a 7-foot gator back there.
Oh, jeez.
But something was wrong with his left rear leg, so I think we need to call Dr. Mark Day, the orthopedic guy, I sent him a video, and I said, "Look at that left rear leg. What can you do for that gator?" He never got back to me.
which means you're never going out on that pool deck alone.
Well, there's a fence there, but I'm telling you, we look under the car now. When we take the dogs out
Yeah.
out the front. Yeah, we look under the car. But I guess it's mating season because someone
Yep.
2 doors down said they heard that primal mating. I've not heard
Yeah.
it, but yeah. So that's my
We
story.
have deer everywhere right now. I mean, I go out to get the paper in the morning, and then we have a family of like 5 or 6. There's a path they cut through the neighborhood, and they're out there every morning, like looking at me, like, "What are you doing?" And I'm like,
Jeff,
"Get off my lawn!"
Janet had Lyme disease, Lyme and Bartonella, by the way. But
Yeah,
you're in a high
I'm a
area in
survivor.
Delaware too,
Yeah, we're in the
right?
height of
They're everywhere.
Lyme country and actually Rocky Mountain spotted fever country, even though the Rocky Mountains aren't around
Yep.
here.
Right.
Yep.
But we see a lot of that, and it does affect the eyes, as well as just the orthopedic stuff as well.
Yeah. Yeah.
I garden a lot, and I spray with, is it permethrin? Is that what I use?
And you
The
bought
permethrin. I mean, everywhere.
you bought those clothes that had permethrin in it too.
Yes, and you can only wash them like 12 times or something. So like I never wash them. I don't care. I just wear them, and I only garden in them.
So Jeff, any Biden stories? No
Well,
calls for commander?
so we've in our first hospital when he was being considered for vice president. His house was only about 7 or 8 minutes from our hospital there. So the Secret Service had to come through and scan because they were worried not so much about his dogs, but the service dogs that were with them. If something happened or injured or shot, they wanted to vet the hospital and make sure that it was appropriate to bring in. So we had that. We've had those sweeps, which are interesting. We've had, we used to be able, when he was vice president, he had some issues with some of his dogs and with his son's dog. And so you knew when you pulled up in the morning and all the big black SUVs were there that you were going to have an interesting day. And it just funny. I mean, there was one story when he met the surgeon for the one dog the first dog that I think Champ, it may have been Champ, I don't remember, but it had some problems with its elbows. And he came in and he was talking to the surgeon, and he goes, "Well, I can't really decide on this right now. I need to go ask my wife if she'll let us do this. And besides, I'm going to Iraq tomorrow, and nobody's supposed to know about it, so don't say anything." And like the next day on NPR, it's like, "Oh, he made a surprise visit to Iraq," and I'm like, "Oh, we heard about that yesterday." So, but yeah, that's about it. Nothing. I mean, it is interesting here. Like I said, his place is just around the corner from my kids' high school, so they'll have in Delaware. There's a big thing called Joe Jams, where when he's coming through, traffic everywhere. So.
Got it. I'm curious. Sweeping the office, looking for what?
Well, I think they were
nobody
looking
knows
more for where like access points were, because if when they come to our clinic, then somebody had to be at like every door, and they had to be in the hallways, and so there were Secret Service agents everywhere. So.
Well, we had Dick Goddard at our clinic.
Yeah.
With no security.
Right. Hey, I'll tell you, he was quite a comedian.
Yes,
he really was. When he was leaving, the girls said, "Oh, Mr. Goddard, do you think we could get our picture with you?" And he said, "Yes, because I'm not in the witness protection program." I mean, he was a jokester. It was cute. Yeah. Yeah. Well, I can't thank you enough. I'm sorry we had problems at first getting you on, but hey, technology, what can I say?
Nope. It was good to touch
It was
base
so
with
good
you.
seeing you again. We have to catch up on Dr. Partial stories one of these days.
Well, and you took care of my dog when I was in high school. You took care of one of my little dogs, and she was I had mono in high school, so I was laid out for like a month, and I was an ice hockey
Oh,
player and couldn't play. And that little dog was a great little thing for me. But
oh.
she chewed herself raw, and you made her grow hair back, so that was good.
Well, we try, and
Oh,
I'll tell you, Durham has come a long way since I saw your dog. I mean, you got to admit, with our monoclonal antibody and Apoquel, and so thankfully, and ophthalmology, I think, has actually come farther than Durham, though, because gosh, all your new equipment, and when I think of when Dr. Partial took out cataracts, he only took out one. Remember?
Mhm.
That's back in the day when they only did one eye, and they didn't even do a lens most of the time. So things really have come full circle, I
Yeah,
think.
they have
Yeah.
small incision injectable lenses now, and yeah, there's a lot of
Mm,
neat stuff.
so cool.
And quite honestly, what's happened too is I've been in it long enough that I've seen some things that were like touted as this is the best newfangled thing. Now we're going
Yeah.
back to there's too many complications with that newfangled thing, so we're not doing this. So certain breeds we're sometimes not putting artificial lenses in because we know that sometimes they'll cause a little more problems than other breeds.
Yeah. Yeah, I see that too when I'm at a derm meeting and we're at a round table and I see some of the new derms that I don't know, and they're bringing up something, and I'll turn to my girlfriend and say, "Remember we did that 20 years ago and it didn't work." It's you can't reinvent the wheel. You got to kind of learn from history. Yeah. Well, listen, thank you, Janet. You have any parting words? Should we do an OH?
oh,
Oh.
oh,
Oh.
go Bucks.
So thanks everyone for tuning in. I hope you learned a lot about eyes today. Remember, eyes are an emergency. Call your vet ASAP. So this is Dr. Alice Novotny Jeroman and
Janet Novotny King saying, don't let your dog hang their head out the car window.
right, or Dr. Bowersox will be there. And
That's
we
right.
are the Novotny sisters wishing you a great day.
Thanks for listening.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and/or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.